Hi, welcome to this second virtual presentation as partnership of the Bloomfield Public Library and the West Hartford-Bloomfield Health District. I'm Susan Walsh. I'm a nurse at the Public Health Clinic at West Hartford-Bloomfield Health District, and I'm going to share my screen and we can enjoy a PowerPoint together. So I'm going to be talking today about lead poisoning prevention and immunization updates. This is about an hour presentation. Get all things set up here. All right, so why did we choose immunizations and lead as part of our October presentation? It's because October is Children's Health Month and National Lead, excuse me, I just have to lessen something here. National Lead Poisoning Prevention Week is also in October. It's October 22 to 28. So our plan today is we're going to talk about lead mostly. Good 30 to maybe 40 minutes is about lead, and then we'll talk about immunizations for 10 to 15 minutes, and then we'll answer questions. So the biggest takeaway from this presentation should be that lead poisoning is 100% preventable. I'm going to be giving you a lot of information about lead, but if you want more information, you can go to the Connecticut Department of Public Health's Lead Poisoning Prevention and Control Program or the Centers for Disease Control's Childhood Lead Poisoning Prevention Program. They're excellent resources. So lead is a public health concern, and there are regulations that control how the health district is involved, as well as other things that control safety around lead. These are the regulations for that. And if you want more information, you can contact the library for handouts that provide this information too. So lead is a public health concern. About 3.3 million American households with children under the age of 6 have lead exposure hazards from lead in deteriorated paint, or dust, or soil, including 2.1 million low-income households. Even very low levels of lead in children's blood are linked to adverse effects on intellect, concentration, and academic achievement. While the United States has made substantial progress reducing lead exposure for more than 40 years, significant disparities remain along racial, ethnic, and socioeconomic lines. For example, Black children and children from low-income households have persistently been found to have higher blood lead levels than non-Hispanic white children and children from higher income households. So what are some of those regulations and what do they mean? So a big part of this is that all children between the ages of 9 months and 6 years need to be tested for lead. So between the ages of 9 months and 3 years, children need to be tested annually for lead. And children aged 3 years to 6 months must be tested if there are some indications for it, if there are some risk factors. All children under 6 years old need to be tested if clinically indicated. That means like if they have symptoms of something suggestive of lead poisoning. And medical providers must provide education and guidance to parents regarding lead poisoning prevention before testing. Also, medical providers must conduct a medical risk assessment at least annually for children between the ages of 3 years and 72 months. So what are those risk assessment questions? Well, here they are. So we're going to be talking in this presentation about a lot of lead risks, a lot of lead hazards, risks for children. A big part of that is related to lead in paint. So this first question highlights that. Does your child live in or regularly visit a home or a facility built before 1978? Question about whether the child has a family member or a friend who's being treated for lead poisoning. That would suggest that the child may have had similar exposures. Also, there are questions about whether an adult in that child's life has a hobby or a job that puts them at risk. We'll be talking about what some of those things are. And we'll talk about, the doctor or medical providers would talk about that child's access to imported products, which may not be subject to the same regulations as we have here in the United States. So a key thing to think about is that if you have come to Connecticut after that window of time where routine lead testing happens, so after that age of 3, then you can fall through the cracks. If you don't have a regular primary care provider, you can fall through the cracks. So there are different levels of safety that are trying to ensure that all children under the age of 6 get assessed for lead. So if we test someone for lead, if that's the requirement, what does that mean? So here's our table. Children with an elevated blood lead level have to have additional follow-up screening. There's a requirement of medical providers and laboratory testing companies to report to the state, and the state then reports to the local jurisdiction, the local health district, all blood lead levels of 3.5 or higher in children under the age of 6. So the higher the lead level, the more frequent testing and monitoring and interventions. There are 2 kinds of tests. Well, these schedules, these tables show what some of that frequent testing system is. And the health district would stay involved with that family until that child has a lead level that's below 3.5. The child may be well over 6 years old at that point, but we would stay involved until the lead levels get below that threshold. So let's talk more about the different kinds of lead tests and what these things mean. Venous blood lead level testing is the most useful screening and diagnostic test for recent and ongoing lead exposure. That's the picture that you see in the top right-hand corner. This is the kind of blood test you get at Quest or at LabCorp. It's a very accurate kind of test. Zinc protoporphyrin testing is another kind of venous blood testing, and it's used to detect the average exposure to lead over the last 3 to 4 months. It is not sufficiently sensitive to test to get us that information when the child's lead level is fairly low. So it's really good when the child has a lead level of 20s, 30s, 40s, 50s. And that's able to give us a good sense of whether or not the child's lead exposure has been related to a recent exposure or to chronic exposure. Capillary blood sampling is what you see in the bottom image. That's a test that some doctors' offices are able to do. It's a test of prick the finger, get a drop of blood, and sample that. It's a good test, but there's a lot of potential for lead contamination. So any capillary blood lead test of a 3.5 or higher must have follow-up confirmatory venous blood testing. Now, for people who have chronic exposure to lead, they will store that lead in their bones and teeth, and that can set up situations where the blood lead level may appear normal, but the child has stored a lot of lead in their body. And then that lead can come out of their bones and other parts of their body and re-enter the bloodstream at times of growth spurts or at times of stress. So lead absorption. The amount of lead a person absorbs varies. Some of those factors are the size of the lead particle, whether it's a piece of dust or it's a lead paint chip, the route of exposure, whether it's inhaled or swallowed, the nutritional status of the person, how healthy they are, the status of whether their stomach has food in it or not, the person's age. All of these things influence lead absorption. So if a child were to swallow a paint chip, it has to go into the stomach, and then a lot of that lead is absorbed into the bloodstream. But that lead chip is also just passed out eventually by the body. So the body naturally excretes lead through urine and feces. But a lot of that lead is still going to be absorbed out of a paint chip. Now, if you get lead dust and breathe it in through your nose, and that goes into your lungs, deep into your lungs, your body will absorb a lot of that lead, a higher rate of absorption than swallowing a lead chip. Adults and children absorb lead differently. So children at their growing bodies are much greater risk for lead poisoning. So a child, if they accidentally, have lead on their fingers or have a paint chip, and they inadvertently or intentionally put their fingers in their mouth, that lead gets absorbed up to 100% if the child's belly is empty, if the child doesn't have a full stomach. And that's compared to if the child does have a full stomach, and then about only 50% of that lead is absorbed. For adults, adults absorb about 20% of ingested lead after a meal, and only up to 60 to 80% on an empty stomach. There are a lot of factors to lead absorption, and we really have to avoid them all. A big thing to think about, though, is lead dust, lead paint. It's very easy to get lead on your fingers and then to touch other things that then go into your mouth and give an ingestion type of lead exposure. So key things to know about lead, we've already talked about some of these things. Lead poisoning is a completely preventable disease. There is no safe lead threshold, not at all. Now, you may have heard in your life that there are safe levels of lead. When I was growing up, that level, sort of the general thought was we could have a level of 40 that would be safe. When I had my children, the level was about 10. That we didn't get really worried about lead exposure until the level was about 10. Now we say there is no safe lead level, and a level of 3.5 is a level of concern. It's a level at which a local health district gets involved, and that a child really does need to have follow-up. Once lead gets into a body, it can hurt the brain, kidneys, nervous system. Not everybody who has high levels of lead or lead poisoning show symptoms of it, but the lead itself is toxic, and it is harming the body regardless of whether or not there's symptoms at present. Lead poisoning causes bodies to grow more slowly, for development to happen more slowly, to cause difficulties in learning, behavioral problems. We've talked that young children absorb lead more easily than adults. And this next point is really in support of what we were just talking about, nutritional status. A healthy diet with lots of food and iron, calcium, zinc, and vitamin C can keep lead from being absorbed into the body. If your body doesn't have things like iron, lead, zinc, and vitamin C, the lead absorbs and kind of replaces that in the body. Another thing is that how you clean your home can make a big difference in a child's lead exposure. And we'll be talking about that in future slides. So what is lead? So lead is a naturally occurring, very soft, dense, moldable metal. It's a very stable element, and it accumulates in the environment. Lead's resistant to corrosion. It's a poor conductor of electricity. It's an effective shield against radiation, and it's toxic. So because of those properties, it's been used for a lot of purposes for thousands of years. Romans used it in plumbing. We've used it in plumbing, gasoline, paint, batteries, commercial products, insecticides and fungicides. It's toxic, and so it has worked really well, putting lead poisoning on orchards to kill the insects and fungus. It worked great in that way, but then it's poisoned the ground. It's caused a lot of soil contamination, for example. All right, so, excuse me, my screen's acting funny. All right, so let's talk about jobs that may involve exposure to lead hazards. So we're going to talk about regulations that have limited the use of lead in a lot of products here in the United States. But lead is still used in a lot of things. So it's still used in the automotive industry and in ballistics, in recycling and smeltering, and a lot of artistic and projects. It's used in a lot of building projects, structures, bridge paint still has lead in it. So there are a lot of different kinds of ways that people encounter lead frequently: welding, cutting. We also encounter lead in hobbies. Swap screens here. So stained glass, the metal between those pieces of glass, that's lead. Anything involving bullets, fishing weights, that has lead in it. So if you spend your Saturdays fishing or going to a firing range or hunting, these are times that you have exposure to lead. Ceramics can involve lead. So the pigments in ceramics can have lead. The glaze on the pottery itself can have lead. If you make your own alcohol at home, there are ways that lead can get into that process. And of course, if you're someone who just enjoys wine and stores your wine in leaded glass, the lead from that glass can get into the alcohol too. Also, many of us do home renovation, repair, remodeling, painting on small to large scales. All of those things put us at risk for exposure to lead, particularly in structures built prior to 1978. And we'll talk more about that. So if you have exposure to lead in your jobs or hobbies, you have a responsibility to prevent others from getting exposure to that lead. So if you work in a automotive place at a shop that's changing oil and working on cars, if you then get into your own vehicle and you're still wearing the clothes that you've worked in, your car seat now has lead contaminants from the clothes that you're wearing. If you routinely take off your jacket and toss it in the passenger seat, that seat now has lead contaminants. So you'll need to be really thoughtful about what you do with your clothing, your shoes. And before you go into your home or into other properties, you need to be careful about washing hands, showering, changing your clothes, changing your shoes, wash clothing separately. Lead in drinking water. We're now going to shift into talking about three big sources of lead contamination: drinking water, paint, and soil. So as a country, we've made real efforts to limit exposure to lead. We still have a ways to go. So let's talk about lead in drinking water first. In 1974, the Safe Drinking Water Act was passed by Congress, and then there were amendments in 1986 and 1996 that addressed some lead hazards. And also in 1991, there was a lead and copper rule. That was another effort to reduce lead exposure in water. That lead and copper rule recognized that corrosion of pipes and fixtures is a big source of lead in water. So the inside of pipes and the solder that holds pipes together, if there's lead in those things, it can get into the water. So that lead and copper rule involved adding some anti-corrosive things into public water supplies to limit the amount of lead that could get leached out of the water. So despite these amendments and this act and the lead and copper rule, things can still fall through the cracks. Probably all of us have some familiarity with the Flint water crisis, the Flint, Michigan water crisis. And that happened in 2014. And that was a result of Flint, Michigan changing their water source, sort of temporarily changing their drinking water source, but they didn't implement those corrosion controls. And so what that caused was for lead to leach out of those pipes and solder into the water in a rate that it hadn't been before. And then all this leaded water was then going to the homes in that area. And there was a very large rise in lead poisoning and exposure to lead. So we need to be really cautious about following these rules very carefully. Now, homes built before 1986 are more likely to have lead in their pipes, fixtures, and solder. We can be grateful for some of these amendments to the Safe Drinking Water Act that's caused there to be some more protections since then. Certainly, lead can still leach out of pipes and such, even with those anti-corrosion additives. How much lead is leached out is in part dependent on how long the water stays in contact with those leaded surfaces, as well as the temperature of the water. So if you've been out of your house for a while, or you've woken up in the morning and the water hasn't been on overnight, it's a good idea to flush your pipes to get that water that's been standing and absorbing lead for some period of time. Also, hot water absorbs lead more readily than cold water. So, if, for all of us, a good idea is to fill, if you're cooking or drinking, use cold water. So if you're filling a pot of water for rice or pasta, fill that pot with cold water instead of hot. Now, another thing that we can be grateful for is that President Biden's bipartisan infrastructure law has included $15 billion in funding to remove lead-containing water service pipes that connect the public water supply with household plumbing. So Connecticut is already in the process of benefiting from that. So lead in paint. So before we move into this, I just want to say that Connecticut is doing really well with preventing lead poisoning through water. Our real main sources of lead poisoning here is with old paint stock. So Connecticut has a lot of old housing and a lot of leaded paint. So in 1977, the Consumer Product Safety Commission limited the lead in most paints, that standard household interior exterior paint, to 0.06%. Let's think about what it was before then. So before 1955, for example, White House paint was 50% lead and 50% linseed oil. It's a huge amount of lead. So 1955, the paint manufacturers adopted a voluntary house paint lead content standard to try to get more household lead paint down to about 1%. So we've gone from some paints with 50% of lead to now in paints that were created after 1977, paints with lead down to 0.06%. Again, this is just household paint, paint that's used in bridge painting, a lot of these big industrial things, aeronautics, a lot of that paint still has lead in it. So it's probably clear to you is that the older the house, the more likely it is to contain lead-based paint. And the older the house, the higher concentration of lead in that paint. And also the older the house, the greater the likelihood of it having deteriorated paint. So, so we really need to be thinking about our own homes as having kind of a gradation in the level of lead that we expect it to have. Now, lead paint chips, degrades into dust, and that's a big source of lead poisoning. So if leaded paint is painted over with newer low lead paint, that can be very protective, but that under layers of leaded paint can still get released. So if paint is chipped, has friction, like at windows when you're opening and shutting windows, that's paint against paint, rubbing against, paint of the window, rubbing against the paint on the frame. that creates dust from that deteriorating paint. And if there's leaded paint in there, that turns into leaded dust. Think about doorways. You're coming through a doorway, maybe you've got a laundry basket, you're bumping against the laundry basket, against the door frame, creating points of impact, friction, peeling. Those are all ways that the leaded paint is becoming exposed. And of course, we all know that children can chew on surfaces, on windowsills, on door frames. They can suck on doors. Those are all ways that kids can get access to that leaded paint too. Excuse me. As paint chips and degrades, it turns into dust. That dust can get on fingers can go in mouths, that dust can get on toys, on clothing. That ends up resulting in ingestion, and it can also get airborne and get breathed in as lead dust. So now we're going to talk about lead in soil. So lead contaminated soil continues to be a really hazardous source of lead exposure for young children in the United States. So think about how that relates to paint. So if the exterior of your home has leaded paint, even if you have newer paint on the surface, eventually that paint degrades and that leaded paint turns to paint chips and cracks and chips and turns into dust, and that goes in the soil. That's a source of lead in soil. Gasoline has been a big source of soil contamination too. Gasoline had lead into it from, I think, 1924, and then it was banned in 1980. That's another big source of lead poisoning in soil. And industrial sources like lead that's used in pesticides and fungicides, that has contaminated soil surfaces too. So soil contamination is particularly common in urban areas and in places where there are a lot of homes built before 1978. Well, that certainly describes Connecticut. So to avoid bringing that lead into your home, take just good precautions. Take off your shoes before entering the house, and that prevents bringing lead-contaminated soil in from outside. Prevent children from playing in bare soil. Prevent your pets from playing in bare soil. And until that, cordon off that bare soil. Don't let anybody in it, but grow grass, put wood chips over it, put mulch over it. That really protects you from the contaminated soil. It's probably obvious, don't grow fruits or vegetables in lead contaminated soils either. So container gardens is a good alternative as a way to grow fruits and vegetables if you have contamination in your soil. So now we're going to talk about lead in imported products. We've talked about ways that the United States has regulations that are trying to limit the amount of lead exposure in products that are made here. But a lot of things are imported, and also, of course, here in the United States and elsewhere, a lot of people make their own things: ceramics, stained glass, other things that involve lead. So lead can be found in food, cosmetics, traditional medicines, all sorts of things that might be imported in from other countries. What's the source of lead in those things? It can be varied. So here in the United States, we have a lot of regulation that prevents lead in ink. Some countries don't have that. So if a food product is wrapped in wrapping that has ink on it, and if that ink has lead in it, that lead can absorb into the product, whether that's candy, medicine, food, spices. That lead can get entered into those things in that way. Also, lead can be entered intentionally into products. If something is sold by weight, there's some motivation to have that product weigh a little bit more. So we've seen this in spices. Sometimes lead and other heavy metals might be added for weight. But we also see lead inadvertently getting introduced into foods and products during grinding, drying, and coloring processes. Very much inadvertent. In the United States, cans that store food don't have lead solder. So solder is the liquid lead that sort of functions as a glue to hold metal together. So our cans, like if you buy a can of beans, there's no lead in that can of beans. But if you buy imported cans with food or drinks in them, some countries still use lead in their cans. So you can get lead absorption into the product that way. Also, pottery, ceramic ware, we talked about this already. There are lead-based pigments and there are lead-based glazes. So on any kind of ceramics that you might use, if your ceramics are getting worn down, you're at risk of, even if they were sold legally with here in the United States, with a glaze that was protecting you from some leaded pigments inside, you're risking that lead to come in contact with food and liquids as it wears down. Lead's been used in imported home remedies and medicines. There's a great handout for this, and you can contact the library or in the chat of this. There'll be a nice handout with some examples of imported home remedies and medicines that are known to have high levels of lead. Also, lead's been found in products that are typically used as cosmetics or in religious ceremonies. So kohl, it's a black eyeliner, may be used as a cosmetic, or a cinder, a red powder that might be used in hair and in religious ceremonies. Those things might not be given to a child or consumed intentionally, but if a child is touching the face or the hair products and gets these things on their hands and then puts it in their mouth, well, there's a way that they're having ingestion of lead. Another source is metal wicks and candles. So imported candles sometimes still have a metal wick, and that metal wick may have lead in it. So lead in toys, I find that this is a really important slide. Now, we've talked about ways that lead has been, that regulations have prevented lead from being in toys. Well, here's a way that it hasn't. So the use of lead in plastics has not been banned. So lead is used to soften plastic and to make it more flexible so that it can go back to its original shape. So it may also be used in plastic toys to stabilize molecules from heat. And when the plastic is exposed to sunlight, air, or detergents, the chemical bond between the lead and plastics breaks down and forms a dust. And a young child may touch that plastic toy and then ingest the dust when they put their fingers into their mouth. So when I think about this, I think of my own children and the toys that would go outside, and the soft plastic faced dolls that they'd take outside and they'd stay in the sandbox, and they'd be in the hot sun all summer for months before we'd realize that they were buried in the sand, and we'd take them in. Like if there was a lead in that soft plastic, that could have turned into broken down into to lead dust that has a potential to contribute to lead poisoning. Jewelry often also has lead added, particularly imported jewelries. That lead functions to make the product heavier, to brighten colors, or if it has plastics in it, to stabilize and soften the plastics. Jewelry labeled as made in the United States is less likely to contain lead compared with jewelry made abroad. But take caution. Children shouldn't be allowed to wear jewelry that may contain lead because of exposures to chewing on it, sucking, swallowing the jewelry. Imported toys, I think this is probably obvious. Different countries have different regulations around lead. So if you're getting a toy from another country, it may have lead paint or other lead in it in other ways that are at a higher level than what you would be able to buy here. Also, antique toys. Probably a lot of us have favorite toys from our own childhood that we saved for our children or grandchildren. lead regulations were different at that time. So maybe put those things up on shelves. Don't let your kids play with them. All right, let's shift into lead recalls. So despite some really good regulations to prevent exposure to lead, things do fall through the cracks. It's really important to check the Consumer Product Safety Commission's lead recall site fairly often to just see if any of the items that you use or own or bought might have been recalled for lead. I've included 4 images from that website to give some sense of what some of those lead recalls may include. It's a really easy to navigate site, and I encourage you to go through it, again, pretty routinely. You'll see a picture of some Minnie Mouse pajamas. I know the text associated with these recalls is really small, so I'll just highlight that the lead in that product is actually in the ink that's on the clothing. So that's textile ink, and it does have lead in it, and there's a recall on it. The other top picture, that's a picture of a pin like you put to your shirt. It's a metal doll pin, and it has high levels of lead in the paint of that product. The 2 lower pictures are toddler stainless steel bottles and some children's cups. There are high levels of lead in both of those items too, so there have been recalls on them. So pay attention to those lead recalls. It's kind of shocking what can fall through the cracks. So now we're going to talk about lead-safe work practices. So if you're in a property that you recognize now may have some lead in it, it's really important that you follow lead-safe practices if you're working on your own home. So bear with me, having a computer issue. So it's probably clear that if you have a chip of paint on your wall and you want to smooth it down so you can repaint over it, if you think about what happens if you were to bring some sandpaper out and try to sand that area smooth, you're making lead dust. If there's any leaded paint on that surface and you sand it, you're creating lead dust and you're making it airborne so that you can breathe it in, and then it goes into the air and it settles out on counters, surfaces, bedspreads, everything. So it's really important to wet surfaces before scraping or sanding that contains the lead. If you're thinking about exterior paint, that temptation might be to do power washing. That's using this real high pressure water to spray on the exterior of your house to remove all chipped paint. Well, think about what that would do. That would bring this leaded paint down into the soil for lead contamination, and it would also create these air drafts that would cause the leaded paint to break up more and get airborne and be something that people would breathe in too. So be sure that you're using personal protective equipment, masks, and coverings when working on painted surfaces, and use containment and barriers to prevent paint chips and dust from spreading from the work area. Now, contractors who work on disturbed paint surfaces, so people who are doing renovation projects for you and things like that, those people who work on homes built before 1978, or childcare facilities or schools, they all have to be certified for that. So federal law requires contractors who work in those sorts of things to have a certain certification and knowledge in ways and work practices to prevent lead contamination. Now, lead abatement is a way of intervening in leaded environments to a higher standard. So it's a higher standard of intervention that involves removing lead paint, replacing things that had been leaded. It can involve encapsulation, meaning enclosing that lead, either through rigid surfaces, liquid encapsulation, which is like a really thick paint, or a cementous encapsulation. So if, like on that last screen, we talked about how certain contractors coming in, you might hire to do work on your home. If they recognize that your property has lead in it and there's a child under the age of 6, then they're required to report to the health district, and the health district would issue a lead abatement order. When there's, and so that lead would need to be cleaned up to this standard of lead abatement. We also, as a health district, get notified when a child's lead level exceeds a particular threshold, 3.5. If that, when that happens, I, as the nurse, would contact the family, discuss lead hazards, risks, and we'd have someone from our environmental health department come in and test the paint, dust, soil levels. And if lead paint is identified in that area, then the property owner would need to do lead abatement. Strategies to limit lead exposures in the home: of course, place washable mats inside and outside of the house to limit tracking lead in. Take off your shoes before entering the house. Wash those washable mats that have accumulated lead. Keep your pets from tracking lead into the home. Prevent access to bare soil. Clean feet and fur. Avoid dry sweeping, which puts lead airborne. If you're going to be vacuuming, use an industrial level HEPA vacuum. Otherwise, regular vacuums, pull in junk, but then the dust is a very small particulate and it can get back into the air and settle on surfaces. Use wet cleaning for all non-carpeted surfaces, including floors, windowsills, window wells, radiators, toys. There's a 3-bucket system that we would advise you in on how to do deep cleaning, but generally just high detergent and water cleaning strategies make a big difference. Wash your hands frequently.